Hi, I'm Tyson Franklin, and welcome to this week's episode of the Podiatry Legends podcast. With me today is Dr. Sanjay Sharma from Bangalore, India. Now, he was on once before, back September 2020. It was episode 103, and it was just titled Podiatry in India. So I thought I'd get Sanjay back on here because he's been doing some really exciting things in India. Plus, we want to get an update on what's happening with podiatry in India. So, Sanjay, how are you doing today?
Hey, thank you, Tyson. It's been really pleasure to catch back COVID. We have been doing pretty well post-COVID in India, and happy to share what's happening at my end, this part of the country, with regards to podiatry.
It's amazing, isn't it? I think it was 3 years ago that we spoke, and so much has changed. The world has changed a lot in 3 years. And when we spoke last time, I was just amazed the process you had to go through to become a podiatrist in India. So what's the latest developments? What's happening over there now? What's changed in the past 3 years?
Uh, on ground, nothing much. We still do not have a podiatry program in India, and people like me who have been traveled either to US, Europe, UK, or Australia, South Africa, come back and practice podiatry in here. We still have a large number of diabetic foot patients. But the good part is we are looking at bachelor's programs in podiatry as a paramedic. In a short while, we've been talking to a couple of universities. One is a university in UK, and the other one university in Australia. So there is some progress in terms of starting the podiatry programs, bachelor's programs in India. So that's the good news. But on ground, if I'm looking at, has anything changed with training of podiatry? No, it is as it was in 2020.
So, so if anyone hasn't listened to episode 103, to become a podiatrist or call yourself a podiatrist in India at the moment, you have to do your medical degree first.
So
Yeah,
we do not. It is podiatry is not recognized a branch of medicine in India, either at
yeah.
undergraduate or a postgraduate level. So if you do your basic degree in medicine, which is called MBBS,
Yep.
Masters, Bachelor's of Medicine and Bachelor's of Surgery, and after that you complete your MS degree, that is Masters in Surgery, which can be in general surgery, orthopedics, or any of the other related surgical departments. Then you travel to UK, US, Australia, South Africa, train, get a fellowship in podiatry, or train yourself in podiatry and come back and practice. So, or practice podiatry just by the interest, love for it, and interest for it without any qualification,
Yeah.
just with the MS, Masters in Surgery degrees.
But still, there's a long road to get to that point. There's a lot of training involved. So you'd have to be very keen and eager to want to go down that path. So
Absolutely.
how many podiatrists are there now then that have gone through the same path that you followed in India?
Same pathway we have gone through could be hardly less than 75, around
Okay,
75,
not a lot.
for a 1.4 billion population.
No saturation there, is there?
Yes. So have a lots and lots of opportunities for podiatrists to come over here and practice.
So can podiatrists from other countries come to India and work as a podiatrist?
Under a medical doctor.
Yeah.
You cannot have an independent practice because, as I said, podiatry, either a DPM from US or MSc in podiatry from UK or any of that is not recognized in India yet. So they can work under a medical doctor.
Okay, so if an Australian podiatrist who does everything but doesn't do surgery, if they wanted to work in India, they would have to work for you,
No, without
supervised.
if it is no surgery, they can work here. So nobody stops.
Oh, right, okay.
If there is no prescription, if they're not prescribing any medicine, drugs, and if they're not doing any surgery, then they can come and practice.
Oh, right, okay. There you go. 1.4 billion people are screaming out for podiatrists.
Yes. And as few of the statistics say, 47% of them have a foot issue.
Wow, that's a massive amount of work, isn't it? Which sort of probably got you, because one of the other reasons I wanted to talk to you is you've set up like a chain of foot clinics called Foot Secure.
Yep.
How did that get started?
So as I said, as we completed my fellowship under David Armstrong and came back to India, we saw that there is a whole need of a complete podiatry solutions. It is not just a diabetic foot care. As we discussed in the last episode, there's a huge amount of diabetic population and the huge amount of diabetic foot conditions that we treat. I've said one of my colleagues sees about 80 patients, diabetic foot patients a day. I see about 30 podiatry patients a day in a private practice. So that's the kind of volumes that we see. And
Wow.
with about 74 million diabetics and 50% of them having a diabetic neuropathy and 19% of them having a diabetic foot ulcer, and 140,000 amputations happening every year in India. That is a huge, we believe that podiatric interventions can save a lot of limbs. And so that was the primary intention in terms of Foot Secure being started, where we can save limbs and save lives. And not just focusing on diabetic foot, because there are multiple other things to podiatry.
Yeah.
So what has come over in the last couple of years with this, with the diabetic foot having such a bad outcomes, and people trying to save limbs, various diabetic centers trying to save limbs or trying to do some podiatry. Podiatry had become synonymous with diabetic foot care. Other things which is generally done in Australia or in Europe or in US has been, people do not consider that as podiatry. So what we wanted to bring it is a comprehensive podiatry solutions, where how it is practiced, where it includes sports injuries, it includes smaller ailments like heel pain or foot pain, ingrowing toenails, calluses, and including diabetic foot surgeries also. So we put everything in place where we provide anything and everything to do with the foot and ankle, from having a foot and ankle surgeries, ankle replacements, diabetic ulcer treatments, to treating minor ailments, giving insoles, giving ped orthosis and AF4s and all of them. So that's what Foot Secure does. And we are at 5 centers now in Bangalore. Centers in the sense we do a shop-in-shop where we establish podiatry departments within hospitals. So that's the model that we have been following.
So you pretty much bring all of podiatry and all the areas that a podiatrist would treat, and just getting it all under one roof. So yes, everything from general foot care through to doing the surgery.
Yes, absolutely. Catering to all sorts of people.
Yeah, and you said you see, was it 50 to 60 patients a day that you see?
I personally see about 30 patients a day now in a private practice, and Foot Secure across all the 5 centers sees about 180 to 200 patients a day.
Okay. So have you noticed, like, with setting this up so far, and there's this big need for podiatry care where you are you having to turn people away? How do you work out who you fit in? You've got 1.4 billion people over there. How do you fit in? Who's going to be the 180 people that particular day?
Depends on first come, first serve. It's just first come, first serve. Whoever takes an appointment. So in the public hospital that we are in, where we call it as a government hospital or a public hospital, it is like whoever walks in that day and registers will be seen. So there is no first come, first serve. There is the registration opens at 8:30 in the morning and closes by about 10 o'clock. And whoever is in between 8:30 and 10 on that day will be seen, no matter what. Even if the doctor has to stay back a couple of hours more, he has to stay back and see.
Okay, that's fair enough. So what's the funding for podiatry over there? So if somebody had a problem, they happen to get in at 8:30, between 8:30 and 10:30, so they're going to get seen that day. How is it actually funded? Does the government fund it, or is it private?
Yeah, so as I said, this hospital where we are working, as I said, a public hospital, that's a government funded. People pay very nominal amount. It could be, if I'm translating it to Australian dollars, it would be about $4.
Okay.
Is what they pay for a complete assessment, including the plantar pressure scans and assessment by the doctor, assessment by the podiatrist or the orthotists. So everything included, pay about $4. And if they're prescribed a footwear or an insole, get it, in $20.
Wow. So how, this is going to sound really bad. How do you get paid?
Okay, no, so that's the public hospital, and we have
Yeah.
a revenue share with the government that we have on that. And in the private setting, where I said I see about 30 patients a day, the way that works is people seek an appointment, as I said, first come, first serve,
Yeah.
until we, there are about, in an 8-hour slot, 3 to 4 hours is booked for surgeries, and then the rest of them are booked for outpatients. So first come, first serve basis, that is what we see. And here we charge about, I said, $10 for a consult, and they might spend about 100 Australian dollars.
Okay.
In a private place to get everything that they needed in the foot, except for the surgeries. Surgeries would be much higher.
Oh yeah, yeah, that's got to cost more. So pretty much, so in a private setting, I think I've got this right now. In a private setting, anyone listening to this will go, Tosh, just pay attention, and you have the answers. In a private setting, you're seeing about 30 a day. In the public setting, you're putting a lot more patients through.
Yes, it's about 80 a day.
So the private setting, you're seeing less, therefore you can spend more time with each patient, and therefore they're paying a little bit more.
Yes, and they get an appointment at the time that they require, and other things. Whereas in the public setting, they just need to wait from whatever time. They just need to come at 8:30 and wait till the doctor sees you.
Yeah, well, it's like any public hospital. Our health system here in Australia. If there's something wrong with you, if you can get an appointment with your local doctor, that's great. But sometimes you got to plan to get sick way ahead, and have an appointment. Or you can just, if something is really bad, you just rock up at the hospital. But you could be there 2 hours, you could be there the whole day. It just depends. So has it taken off better than expected?
Absolutely. So we didn't. So the recent survey, because we get out of these patients that we see, the public hospital, 99% of them are diabetic foot patients.
Yeah.
And in the private setting, we see about 60 to 70% are diabetic foot patients, and the rest 30% are with other ailments. It could be ATFL tears, sports injuries, or anything. So the majority of it, our patients are with diabetes. And from the outcome perspective, a recent survey which was done by a pharma major in India, when they were launching a new dressing product for the diabetic foot patients, the average amputation rates, a below knee or an above knee amputation rates due to diabetes has been 19% in India.
Yeah.
Across all the hospitals, public and private. But at Foot Secure, we are at 2.73%.
Oh,
and
killing.
that is something that I would been very proud of, where we could be able to save limbs of so many people and save lives of so many people.
And it's really
good on that.
Yeah, but pretty much you're showing that early intervention and being looked after the right way by people who know exactly what they're doing, that's a massive difference, like 2.7% compared to 19%.
Yes, absolutely. Simple podiatric interventions, assess them, check if there is a callus, check if there is some ingrowing toenail, nip it at the bud, give appropriate footwear. So just doing these things, we are able to prevent amputations, and also addressing the ulcers very early on. Not until it is gangrenous, not until it is infected and other things. Addressing it very early on has changed the way we treat diabetic foot ulcers.
Tell you, you're a brave man. I couldn't do it. So it says terrible, doesn't it? But ulcers and things like that, everyone knows who listens to this show that I have a really, really weak stomach. And if there's any if there's any liquid involved in anything podiatry related, I go to pieces. It's terrible. So anyone that's doing the job that you do, I tell you, I'm impressed, because I know the people that you're helping is just amazing. So there needs to be more people like you and less like me, especially in that area of podiatry.
Yes. But we've been lucky in terms of we've been having a lot of Indian cricket players, cricket being the religion in India.
Oh yeah.
Where it is, and we have had a lot of Indian cricket players coming in and using podiatry services, football players and other things. And as we said, we also have been, one of the Australian podiatrist, Paul Graham, has been mentoring us to create an appropriate footwears and insoles. And David, obviously as my guru or my teacher, has been mentoring in terms of the diabetic foot perspective. So we did progress quite well in the last 3 years.
Okay, so you say there was Paul Graham that's come over there and helped you out?
Yeah, he comes here twice a year
Okay.
and trains our team, whoever are the physiotherapists who have been trained as podiatrists, or orthotists, P&O people who have been trained as podiatrists. So he comes and trains them, and that kind of a mentoring which is not available. I don't see any podiatrists or any doctor here who can. They all prescribe something like an offloading footwear or an MCR footwear. MCR is a material, microcellular rubber, and an MCR footwear kind of a thing, but nobody is trained to design appropriately a customized orthosis or a customized footwear. So that is where Dr. Paul is, mentoring the team to kind of get those things sorted out.
And what equipment are you using when it comes to scanning and designing orthotics or footwear? What type of equipment do you have?
So we do have a 3-step plantar pressure scans in all of our clinics. So that's something that we always use. We have a 3D foot scanner, and we are just about to buy the in-shoe scan systems, which makes it more and more appropriate today. And we also have some gait labs with a indigenous software called Gait-On, where we can do a gait analysis for the patient. So this is something that we use for the diagnostics. And for the milling, we do have both 3D printed insoles, which we are experimenting. We have not commercialized it yet, but the commercial one is a milling, milled insoles, a CAD/CAM milled insoles is what.
And you're making majority of them, I take it, out of EVA, different densities?
Yes, about the various densities from the EVA.
Yeah, well, Paul Graham's involved. Yeah, the equipment that he's probably teaching is the same stuff I used to have in my clinic. We used to have a couple of platforms in different rooms, had my own milling machine on site. And I remember we did a couple of workshops with Paul Graham on the Gold Coast. We did one called Business and Biomechanics. It was a workshop we did together. Had about 30 people there. It was a fun day.
Awesome. So actually he conducts the online workshops. Yeah. And during COVID, as our patient load was a bit less and other things, I thought to train myself. I attended his workshop, and then we got talking, and he was pretty interested in being involved in Food Secure, and that's how we kicked off. And he has already visited us twice in the last 3 years.
Oh, that's great. Because I know that I think he sold his practice, and he's doing more the online training, just the training in this area, and he just absolutely loves it. And he loves educating other people. So yeah, I think you've connected with the right person. I've got to get him on the podcast at some stage. I saw him at our national conference a while back, and I said to him, you got to come on the podcast. And he went, yeah, I'll get around to it. I don't know if he
Sure, I'll also tell him, because he can share his experiences in India.
Well, yeah, it'd be interesting because one, like he's been around for a long time, like I have, and it's interesting when you're talking to other people how they've seen the profession change over the years. I think back to when I graduated in '88, and what podiatry was then to what podiatry is now. You don't even recognize it.
Yeah. Even in the last 3 years itself, where we started off with a simple plantar pressure scan, and now what we see a need for an in-shoe scanner is itself a change in the way we assess the patient.
Yeah. And now, one of the things you were saying is you're looking for podiatry interns or deep tech interns. What's a deep tech intern?
So we started off. So as we said, 1.4 billion and having 5 centers in Bangalore will not going to solve the problem of either diabetic or of podiatry. So technology is something that we saw is the key in solving the whole problem of addressing the podiatric ailments and diabetic foot ailments across India. So we are developing an app. Possibly it is already, a demo version or a base version is already there on the App Store and the Google Play, which is called Wound 360. Where we take a picture of of any chronic ulcer, especially a diabetic foot ulcer. It can recognize the wound in terms of what is the wound bed, what is the wound edges, what is the peri-wound area, and appropriately tell what treatment needs for that diabetic foot ulcer. And so this is for physicians or healthcare providers, where they can use this app, click a picture, and then say, okay, this is what needs to be, this is what is the wound like, this is the size of it, and this is the characteristics of it, and this is the recommendation of how it needs to be treated. And if they're not satisfied by it, they can. It has a telemedicine protocol also, where they can get in touch with our team of doctors, and we will advise the physician sitting remotely somewhere in a village in India to say what needs to be done. So that's on the Wound 360, and that's why we said we're doing a lot of AI on that. And the second part on the foot also, probably this would be the first time globally also, where we are seeing how can we provide customized insoles and a customized footwear without the patient having to come to us. So we are having a patient walk up and down with a simple mobile phone, taking a video of it and taking various pictures and doing a basic some 10-12 clinical examination, and a nurse or any paramedic can put that data into it, and automatically it suggests what corrections does the insole require, or what corrections does the footwear require, and what offloading, if there is an ulcer or a callus, what offloading is required, and we can manufacture it from Bangalore here and send it to anywhere in India. So these are the two technological interventions that we are doing. So for that, we said that happy to work with interns who are interested in the deep like in the AI and image learning, deep technologies kind of a thing. So that's something. And as I said earlier, also India needs podiatrists, and Food Secure is in an expansion mode, where we have been getting inquiries to start podiatric departments in various hospitals, and if people are wanting to see about 30 patients a day, including diabetic foot patients, not averse to fluids that is there. So they're welcome to come over and intern with us.
So what I like though is how you're using technology, as we should, to reach more people and not rely on just people sort of coming to you. And that's happening in Australia though, with some podiatrists. Well, like COVID, when COVID came through and sort of mixed up things a little bit, how many people now use telehealth as part of their day-to-day sort of practice. I know a few podiatrists that even post-COVID still do telehealth appointments for patients who are a long distance from them.
Yeah, so that's something that has completely changed post-COVID. During the COVID also, we did a lot of tele-wound care. And had amazing results, where we trained the patient attendants on how to dress the wound and other things over a video, and they were able to do it, and we were able to heal the wounds without they visiting the doctors or the nurses.
And sometimes it's just that, like, they can read something in a brochure, or they can read something online, they can even watch a YouTube video or something that could sort of give basic instructions, but there's nothing better, I think, than actually having a live person who's there that sort of like almost holding your hand while you're doing something, and it gives you that little bit more confidence.
Yeah, at least for the couple of times, if there is a hand holding through at least a video call or something, it makes a lot of difference. Yeah,
and then once they actually do it, nothing beats the experience of performing a task. Once they perform the task, they then come back and say, "This is what we did," and you go, "Yes, that's right." Builds up their confidence, and then they do it again.
Absolutely. We also did a roadshow in last November, I think, on the Diabetic Foot Awareness Roadshow, where we rode about 60 doctors, rode bikes across Bangalore, going from one primary healthcare center to other primary healthcare center, creating awareness about diabetic foot. And so we reached out to almost about 30,000 patients in one day, creating an awareness about how to prevent diabetic foot conditions. Okay, and I take it that was pretty popular? Yeah, it was covered in the media and everything. So about 60 doctors going to different localities on bike, different primary healthcare centers was something that was unusual.
And how far did you end up riding with the bikes?
So the Bangalore is about 60 kilometers in radius.
Yeah.
So we did travel almost about 300 kilometers.
Okay. Good effort. And was
In the
that,
sense, like as a
yeah.
groups, in the sense, not everyone traveled 300, but we covered about 300 kilometers together as a group.
Yeah, well, the unfit ones, you don't want the, you don't want to be having to look after them if they couldn't actually make it. So if anyone listening to this wanted to reach out or contact you, what's the best way of actually doing that?
Just is to email sanjay@foodsecure.com. You can also visit the website foodsecure.com and you can find out the email there, or sanjay@foodsecure.com is the best way to reach.
Okay, well, I'll put all your details in the show notes so people can sort of get it from there. Do you have, before we wind up, do you have anything else that you want to share before we finish? Because I've found this, like I said, when we spoke last time, I found it really interesting. Just every time I talk to someone who's doing podiatry in another country, I don't know, I find it really intriguing.
So
yeah.
I would surely put in it was really of great help of the last podiatric legends interview also, because there were people from other countries who reached out and say that we are trying to do this in Sri Lanka, we are trying to do this in one of the Zambia and other things, and trying to reach out to replicate the same model there. So that was interesting. And also I got invited to a few of the European shows to talk to them, talk to their audience about the Indian podiatry situation and other things. So that was the huge impact that interviewing with you on the Podiatry Legends podcast happened. And also taking an inspiration from you, I had this in my mind. You should have seen it in my Facebook also. So I launched the Great Indian Podiatry Show as a podcast, where I'm interviewing diabetic foot surgeons who are practicing diabetic foot surgery in India, in terms of how did they end up, because we don't have diabetic foot surgery or podiatry as a curriculum. So, but how did they end up in practicing diabetic foot surgery or podiatry? So that's something that is completely inspired by you, completely inspired by the Podiatric Legends, where we started the Great Indian Podiatry Show.
That is fantastic. And you know what I really like about hearing that is, one, it makes me feel good that the podcast is actually, well, has helped a lot of podiatrists, but also there's been a few podiatrists that have actually bagged this show, this podcast is not worth listening to. And yeah, I would never come on there, for any reason. But then I'll have someone like you who tell me that, no, this podcast has actually helped you connect with a lot of other people around the world. So to all those people that don't like the podcast, you can get stuffed. That's what I usually say to them.
No, it is worth it. It is absolutely worth the time that we spend on this podcast to kind of reach out to people and send out the message, send out the work that we have been doing.
No, that's fantastic to hear. And it has. I've had a few guests lately, just from different countries, and it's always fun to see what other people are doing. And I think, especially when you're on, I know that show was really, really popular, and I got a lot of feedback from people as well, just saying, I learnt so much about that. And I reckon this episode will be exactly the same. I think it just, especially when we're in a country that has, say, 26 million people, is completely different to a country that's 1.4 billion.
Yes.
So it's just that the scope of what you're facing it's hard to fathom.
Absolutely, I can understand.
So when are you planning to come to Australia? Have you? When was the last time you were here?
No, I haven't been to Australia.
You haven't been to Australia?
I haven't been to Australia yet.
Okay, well, you'll have to put that on your bucket list.
There was an opportunity to visit in October for a conference, but I think I'm off to US because the David's conference, DFCon, and this one is kind of a bit clashing.
Yeah.
So I went to my teacher's conference rather than coming here, but surely we'll make a plan.
So what's the
still there.
conference? What's the conference in America you're going to?
DFCon, Diabetic Foot Conference.
Oh,
DFCon
okay.
is what is there, and there is another Diabetes Feet Australia conference, which is in the same week. So that is what is.
Okay, that's in October.
Yes.
Yeah. So what dates are you? What dates are you in the States?
So we are in early first week of October. I'm in US. Yeah.
Okay. Yeah, I think I arrive the 9th of October.
Okay.
Something like
just
that.
left.
And I'm there. Yeah, I'm there for 2 and a bit weeks. So there's lots that I'm trying to fit in. So Sanjay, I want to thank you for coming back on the podcast. Give us a bit of an update on what's happening in India, and I'm sure to have you back on again. Hopefully not 3 years' time, but have you back on a little bit sooner. There, especially if there's any developments or anything amazing is happening over there that you think, oh, people need to know about this. Just let me know, and also feel like I've got a group on Facebook called the Podiatry Business Owners Club. Feel free, if you have anything that's really interesting or you need to connect with someone or anything, to just post what you want into the group, and I'll let it through.
Absolutely, we'll do that. Thank you for that opportunity.
No, okay. It has been fantastic talking to you again.
Same here. Fantastic talking to you. Fantastic podcast, inspired by you in doing more of this.
Okay. So once again, thanks for coming on. And yeah, like I said, this has always been fun. So thanks a lot.